Let me tell you a story of a modern-day miracle. Cervical cancer used to be a deadly disease with approximately 26,000 deaths in the USA per year in 1941. Thankfully, with the invention of the pap smear, a non-invasive screening tool, and then the HPV vaccine, the death rate dropped to about 4,000 per year. In the past 10 years, however, the death rate has remained stagnant. The most common cause of cervical cancer is human papillomavirus infection, commonly known as HPV. While most individuals with HPV don't get cervical cancer, combination with other risk factors like smoking, high-risk sexual practices, and access to care influence which people exposed to HPV are more likely to develop cervical cancer. Guidelines on who and when should receive pap smears are ever-changing, but one factor has remained unanswered. How does the screening process change if the patient in question has other risk factors such as race, ethnicity, screening history, HPV immunization status, or socioeconomic status?
In Marathon County, chlamydia is consistently the most prevalent communicable disease, with gonorrhea cases currently on the rise. Certain studies show that chlamydia bacteria may help HPV survive in the cervix, which may increase the risk of cervical cancer. Another risk factor for developing cervical cancer is smoking tobacco, with a 2 times higher rate than non-smokers. In Marathon County, 23.3% of adults smoke, which is higher than the state and national averages and is on the rise. According to the study prompting the 2018 USPSTF guidelines, cervical cancer predominantly affects underscreened individuals in the United States who are without insurance or no regular physician. Marathon County per capita income is $30,151, which is again lower than state and national averages. Lastly, 92.8% of adults have health insurance, with 59.7% being privately insured and 19.5% on public insurance. 36% of Marathon County residents report not having gone to the doctor when they feel they should have.
Health First is a community organization located in central Wisconsin whose mission it is to serve all people, regardless of background or insurance status. After Health First staff noticed abnormal pap smears at a higher rate than expected, they partnered with the Medical College of Wisconsin to explore this observation more. Our goal is to identify what risk factors might be causing this trend and how we can work with the community and health officials to mitigate these risks.
We are the faces behind the voices that you've been hearing. I'm Lauren.
I'm McKenzie.
We're going to tell you a little bit about our Pathways project and what it means to us. So, Kenzie, do you want to get us started? Tell us about what it means to you.
Yeah. So when we first started getting involved with our projects, I knew that I wanted to work with Health First. I have a bit of experience with women's health, but I wanted to learn more, and I knew about Health First, so I reached out to them and spoke with Jessica and April to find out what they thought would be the most helpful for a project, and that's when they told me about how much they wanted to expand on Sierra's project, and I was immediately in and ready to go for it. So what about you?
I love that. Very similar. I had heard Sierra talk about her project. Sierra's a 4th year medical student. I had heard her talk about it when we were incoming students, and it was so interesting. And it really felt like something that could truly impact the community with the results. And so I wanted to help out with that. It's been quite the learning experience for me. I really had a limited knowledge coming into medical school, so it's been quite the learning curve. But one of the things that I really took away from this project most was that guidelines aren't perfect. Nothing really is perfect, right? And we're only as good as the data that we have. But it's our job as future healthcare professionals to really advocate to make progress in this field for change. So I'd love to hear, what was your biggest takeaway?
Yeah, so throughout the last 2 years in lectures and working with this project, one thing that stood out to me was that we actually have a vaccine that can technically prevent cancer, and it's the only one that you can say that about with the HPV vaccine, and it should be available to everyone, including the pap smears as well, but we're still seeing this trend of people not getting what they need when they need it. So I'm hoping that with this project, with communication and education, we can get people utilizing those resources and hopefully seeing it done in return.
Yeah, so what are you excited about? All of those same things, but I'm really looking forward to taking our results to local health organizations to really, really continue that progress and change and forward momentum, advocating for the people that need it the most. So, yeah. Well, thank you so much for chatting with us and spending time with us this afternoon.
Oh, we're really passionate about this project and we're excited to see what it brings in the future. So hopefully you are too.
Thank you.
Thank